Young people may have been spared the worst direct effects of the COVID-19 pandemic, but that doesn't mean their lives are not affected by it. A survey of adolescents in low and middle income countries tells us how their lives have changed and how well they're coping. Hello, Kath, welcome.
Hi, Tim.
Now, Kath, when we think of this COVID generation that we call it of adolescents, then obviously in high-income countries, we tend to think of kids that are close to home like us. How similar and how different are the challenges and the concerns for young people in low and middle-income countries?
Yeah, I think being a teenager is tough at the best of times, even when there's not a global pandemic going on. So I think for the young people of the world, it is just a really tough time. Last year, so many people were not going to school or education, with all the things that brings the learning, the social life. In developing countries, it sometimes also means getting your lunch at school. I think in developing countries, low and middle income countries, the economic stresses in the households are there. They're there in rich countries as well. The frustration of restricted movement. But I think, for example, in the UK, we're a lot concerned about teenagers spending too much time on their screens, for example, on smartphones and tablets. In lower income countries, getting access to a screen or the internet or even having electricity is a big concern. So I think getting to learn online is a real challenge for kids in the lower income countries. I think young people in developing countries, low income countries also, they have to do a lot more to help with their household economically. They have to go out and earn money, or they might have to help around the house, help with the animals if they have a farm, help their parents with a business. And a lot of them might even be married by the time they're 18, 19, especially young women. So they might even have their own kids to worry about. And a lot of the families that they live in are really close to the breadline. Literally, they might run out of food on some days. So, similar but different in lots of ways. And I think the most difficult thing at this moment in February 2021 is that in the UK we're starting to feel optimistic about vaccine rollout, and there's light at the end of the tunnel. But in low and middle income countries, that is not going to happen this year. So if new waves of COVID hit, then I think it could come back to stay at home, lockdown, etc. It's happened in Peru recently, and it could happen again. So I think it's not yet over for low and middle income countries.
In this piece of work that we're going to talk about, you compared the experience of young people in 4 countries. Which countries are we talking about? What age are the kids?
So this is in Ethiopia, in India, in 2 states of India, Telangana and Andhra Pradesh, in Peru, in Latin America, and in Vietnam, in East Asia. And we're looking at a cohort of young people who were born just after the turn of the millennium, around 2001. So they were about 19 years old when they were interviewed last year in 2020. There's about 2,000 of them we started following. So it's 2,000 kids in the year 2000, sort of children of the millennium, they're sometimes known as. So we've been following them in the project for 20 years. And we've also been following another cohort of kids who were born about 7 years before them. So we can compare them. And I'll come back to that a bit later about comparing 2 groups of kids to look at the effects of the pandemic.
And so your data from this comes from a study that has been going on for quite some time.
Yeah, exactly. It was set up in 2002. It's called the Young Lives study. It's a collaboration between researchers in the UK. It's led by the University of Oxford. And then there are teams in the 4 study countries in Ethiopia, India, Peru, and Vietnam. So it started in 2002. The aim was to look at the evolving childhood of kids growing up in poverty, and how their lives developed and how they faced challenges and opportunities, setbacks, that kind of thing. So the team has been visiting these children and their families every 3 or 4 years since 2002. So the last time they were visited in person was 2016, when they were 15 years old. And we had planned to visit them in 2020 in person, but, well, global pandemic. So we converted the in-person survey to a telephone interview, which was actually 3 short phone calls. And we've had to rearrange things a bit like lots of people.
Now, these 4 countries, I think they've probably had a different experience of the impact of the pandemic, haven't they?
They have indeed. There's a huge difference, especially between Peru and Vietnam, actually. Vietnam was the first to be hit by COVID-19 early on, but in Vietnam, they locked down very effectively and managed to contain the virus. Very early, strict, proactive measures. And I think they've had almost no community transmission in Vietnam since September. But Peru has had really amongst the worst infection rates and deaths per capita in the world. It's been at the top of this COVIDometer sort of horrible league table of countries. Peru's been really high, close to the top for a long time. So they've been the hardest hit. India has had, I mean, relative to population, not so many cases, but quite a lot of cases. But it's avoided having a lot of deaths. Their peak was around September, and currently it's fairly low, so we're hoping it's going to stay like that. Equally, Ethiopia has avoided very high cases and deaths so far, but now in Ethiopia we also have some political problems. There's some conflict issues and displaced people that might cause problems in the future beyond the pandemic and interacting with the pandemic. I think one of the things we found is that it's not the health effects, but it's the economic and social effects that have been most striking in all the countries. Even Vietnam, I think, hasn't been completely unaffected by the economic crisis. So I think that, yeah, it's tough all round. But I think of the 4 countries, Peru has really been hit the hardest.
Well, let's have a look at that for our 19-year-olds. Before COVID-19 hit, were their lives improving? Were they having a better time of it than the cohort that went before? I mean, for some of them, they're older brothers and sisters, I suppose.
Yeah, definitely. We've seen big improvements over the life course of the project. We've seen big improvements in the lives of young people. So, as I said, they're born just after the millennium, and we've been following them since 2002, interviewing their parents, their caregivers. And so the older cohort were 8 years old, so that when we went back for the 3rd time, that was in 2009, which is actually when I became involved with the project. We visited the kids in 2009. The younger cohort were then 7 or 8 years old. So we could directly compare them with the older cohort when we started the project in 2002. So you've got kids at the same age, sort of aging 7 years apart. And when we compared the 8-year-olds in 2009 with the 8-year-olds in 2002, we found that they were much better off in many ways. We looked at things like their height, which is a kind of overall for a population, it's sort of a proxy for nutrition in early childhood. We looked at the amenities they had as 8-year-olds in their houses, things like access to electricity, access to water, maths, reading ability, what grade they were in school, because often kids in poverty drop in and out of school or they start a bit late. All these counts, the younger cohort looked to be much better off in 2009. And then when we went back in 2013, and then when we went in 2016, the gap was even widening, that this cohort were getting better off, which is a really positive story we had been telling. There were inequalities, there were pockets of poverty, some marginalized groups, that kind of thing. But overall, the general trend is that the younger cohort were much better off than the older cohort.
I've got a feeling that the good news might more or less stop there. So let's have a look. In the pandemic, how has their education been affected?
Yeah, again, I mean, like like the kids in the UK, it's been severely interrupted. It's varied by country. I mean, one thing to say again in low income and middle income countries is that some kids will have already dropped out before the pandemic. They might not have completed primary or secondary school or continued into higher education. But if we just take those who were still in education at the time when the pandemic hit, yeah, a lot were unable to learn. For example, in Peru, it was about 16% who dropped out and hadn't yet gone back by mid-October since February, March. And when we asked 1 in 4 of those, it was due to an inability to pay the fees for school or for college. There were fewer who dropped out in Ethiopia and India, but a lot of them by October were still waiting for the classes to resume in person. About 1 in 5 in Ethiopia, 1 in 3 almost in India. So we're still waiting for the classes to resume. In Vietnam, it was less severe, less than 10%, about 8% of students hadn't yet enrolled. Though some of them, this was because they'd completed high school and decided not to go on to higher education. So that's sort of dropout. The other part of the story, I think, is just being able to continue your learning, even if you're still enrolled. So remote learning, I think, was most successful in Vietnam, and then followed by Peru, which is really related to internet access and electricity access. So in those who were still enrolled in those countries managed to keep going with their studies, communicate with their school teacher, through assignments and virtual classes. In India, this was only 4 in 10, and in Ethiopia, it was only 1 out of 10 who could at all engage in learning activities. And I think, yeah, so that means basically a lost year of schooling for many of those. And I think in India, we were particularly concerned to see that girls in households that were already quite marginalized, lower caste or parents who were uneducated, seem to have even disengaged more with education. So, yeah, it's not such a rosy picture in 2020, I'm afraid to say.
Now, you mentioned in those households, many of these teenagers would already have jobs to do, duties around the house. How has that been affected by the pandemic?
Yeah, that's also another thing that's happened. Parents have lost jobs. Parents have had to take on more jobs. There's been a lot of pressure on households. So it's definitely influenced the way that the 19-year-olds have spent their time. I think in all of the countries, they reported spending more time on childcare, domestic work, that kind of thing. I think it was 80% in Peru had reported an increase in helping around the home and having to do housework. In Vietnam, it was still 40% who said they were spending more time taking care of children, which could be younger siblings, could be their own children. And the other striking thing is that this really affected young women more than young men. Young men tended to work more in the family business and help out on economic activity, as people call it. But in Ethiopia, 70% of the young women reported spending more time on domestic work or childcare. In India, it was almost half, whereas the young men, it was sort of a third or a quarter. So I think, yeah, definitely more of the home tasks have fallen on women. So it's a worry because it's a lot of pressure, especially if they do try to get back into education. If those increased responsibilities stay, then it's going to be a lot to juggle when they have to get back and catch up with this lost year of schooling, I think.
And with the drop in household incomes, does that mean that more of them are working now?
Yes, equally they've had to work in their own home, but more of them have entered the labour force, if you want to call it, going into paid work, for example. In Peru and India, it was 1 in 3 who hadn't been working before the pandemic ended up working the week before we interviewed them. We asked them, in the past 7 days, have you worked for pay? and it was 1 in 3 who hadn't been working beforehand. So they've taken a job because of the pandemic. For older people, it was often they lost a job because of the pandemic, and younger people, it's that they've taken on work because of the pandemic. So there's been a few shifts in the labour market around that. And in India as well, especially amongst young people who were enrolled in education, they took on paid work. Now, some of this might be seasonal work, but we think a lot of it has been driven by the interrupted education, perhaps a return to the family farm, and just helping out to try and basically scrabble for income, food supplies in a crisis, really.
So you put this all together. How has this affected how happy they are with their lives?
Yeah, their well-being, we've measured it every year since they were 8. We've measured their well-being, and it's dropped very sharply compared to the last time we asked them the same question in 2016. We use an instrument called Cantrill's ladder, which it's simple and it's widely used. You ask the respondent to visualize a ladder with 9 steps on it. The bottom step represents the worst possible life for you, and the top step represents the best possible life for you. On which step do you stand between 1 and 9, where 1 is the worst and 9 is the best? So we ask what step are you standing on, and basically the 2020 drop from 2016 is 1 to 2 rungs of the ladder, if you like, which is quite a lot, I think. And this happened in Ethiopia, India, and Peru. But in Vietnam, the trend was upwards, and they actually moved up half a rung on the ladder compared to 2016. So from 12, 15, they were going up the ladder, all of the countries, and then we saw a drop in 3 of the countries, and Vietnam, it went down. And so relative to 4 years ago, it dropped. And then also, if we compare them to the older cohort who I've talked about, when they were 19, which was in 2013, again, as we followed them at 8, 12, 15, the younger kids always reported higher levels of well-being. But again, the drop happened in 2020, and now they have significantly lower well-being than the past cohort, which has never happened before in the 10 years we've been comparing the 2 cohorts. Again, all except in Vietnam, where the gap has widened. I mean, it's a self-report of well-being, and there are discussions about how useful it is, but we've asked the same kids over time. So however they think about this ladder, it's the same kids over time. We also measured mental health for the first time during this 2020 survey, and we used sort of clinically validated measures. I mean, of anxiety and depression, and these correlated as well quite strongly with the drop in well-being that we saw. So the further you drop down the ladder, the worse your mental health was measured by these measures of anxiety and depression. And we'd also looked at other things like, has your household experienced an adverse event, like an adult losing a job? All of this is a pretty consistent story that sort of bad things have happened during the pandemic, and it's led to a significant fall in well-being for this group.
At the moment, Kath, policymakers in these countries are probably focused on the direct health and economic effects and are not really thinking about these issues. But if they do return to them, what advice would you give them about what they should be doing?
Yeah, I mean, this age group in some sense are less of a worry around the health effects of COVID-19. They're less likely to get very sick or die from COVID-19 than an older age group. So it would be easy not to think about them. But I personally think that young people should be a central part of the COVID recovery packages, if you like, that countries are going to have to start thinking about to avoid longer term impact. So as countries are trying to invest in development interventions, I think supporting adolescents has to be taken into account. For example, social protection programs or cash transfers need to be more responsive to different shocks and need to reach young people. I think that education is going to have to be a priority, including trying to help the most affected students who didn't have internet, didn't have electricity, didn't have a place to study. How can they catch up on their learning and I think also for those who've been in work, a lot of young people have lost jobs, a lot of people have taken temporary work. I think we need to think about the jobs that young people are going to need and have measures in place to support them. And especially, we've talked about these pressures on household responsibilities, childcare for those who have kids. If you can support people who have kids to get into work, especially women, I think that would also help with their labour market trajectory, as it were, their longer term career. Because these are young people who are trying to finish an education, or they're trying to start a career, or they're trying to start a family. And so supporting them to have a start in life, really, and all these things, I think is urgently needed. And the final thing I think that is important are mental health services. These are very, very undeveloped in poorer countries. There are often almost no facilities for young people to talk to. You maybe have a couple of helplines here or there, but often you don't have any. So investing in mental health professionals, social workers, community services, I think would be really helpful to make sure that people's needs are addressed.
If we don't do anything, Kath, for the COVID generation in low and middle income countries, what's the worst case scenario? What might happen?
Well, that is a tough question, Tim. I think there is a real risk that, I've just shown you a really happy story of 20 years of progress, and there's a risk that this pandemic could reverse 2 decades worth of hard-won development gains, which could be very damaging in the long term. So I think we really need to support young people in their efforts to recover from the crisis.
Worrying indeed. Kath, thank you very much.
Thank you, Tim.
The paper's called Young Lives Interrupted, Short-Term Effects of the COVID-19 Pandemic on Adolescents in Low and Middle Income Countries. It's in COVID Economics 67. Thanks for watching. As ever, you'll find all the latest research on the impact of COVID-19 in COVID Economics, which is free and open access at CEPR.org.